Hello and good evening, doctors. So today we have with us Dr. Shahid Merchant, celebrity cardiologist from Leelavati Hospital, and we are here to ask him some questions which will definitely help all the physicians in their routine practice. So welcome, sir, on Z Talk. Sir, we wanted to know the journey of hypertension, and nowadays we hear a lot about heart failure and hypertension. So some thoughts on that.
So I think it's a very good topic. Hypertension does lead to heart failure, and the control of hypertension is extremely important with lifestyle management and with the medications. As far as heart failure is concerned, all of you know that it's basically the guideline-directed medical therapy, which is ARNI, beta blocker, MRA, and SGLT2 inhibitors. And we also have the add-on drugs like variciguat and also digoxin in patient with atrial fibrillation and diuretics. But heart failure is a progressive disease, and there is apoptosis of the cells. So there are suicidal myocardial genes which result in heart failure getting into a progressive heart disease. And then as the disease progresses, if you don't treat the disease, then the mortality is high. About 40 to 50% of people will die in the first 1 to 2 years. For that and to improve their quality of life, we have the 4 pillars of the guideline-directed medical therapy. And then after that, patient may need other things like a CRT or even IV Milrinol. If they are in Intermax class and if they are burned out with a cardiogenic shock, they may need a mechanical circulatory support system. And some may also need a LVAD or a heart transplant. Now, as far as hypertension causing heart failure, yes, control of hypertension is important. And initially, I thought the best drug which we used during my even postgraduate days at KEM Hospital was amlodipine. Yes, one of the side effects was swelling, venous edema, and reflex tachycardia. So I found a substitute to amlodipine now, and that is Zevlog, which is azilodipine. And the reflex tachycardia with this drug is much less. I use it as an OD dose, 16 milligram, and patients are tolerating it very well. There is not much venous edema. There is a 24-hour control on blood pressure, and I think it can be the first line of therapy as a calcium channel blocker in patients with hypertension. Thank you.
Thank you very much for sharing your valuable feedback.
Thank you.